Look at that amazing view. Wow. See from your country. Wow, this is really amazing. And also the preparedness of where do you go to sanitize your hands. This is really nice, guys. This is really wonderful, and I really hope that here in the Philippines we'll also have that kind of place that we can sanitize everywhere, guys, just to prepare. This is really wonderful. Wow, that is amazing.
The infectious disease hospital was identified from the onset as a key site for COVID-19 management, with a staff very competent in case management and infection testing. Hospital staff also communicated over media the necessity of the general public staying at home. 16 other hospitals were also initially identified for COVID management and strengthened rapidly with speedy expansion of the hospital network. Hospitals from each district were in early readiness to prevent overwhelming of the health system, even before the first local COVID case was reported in Sri Lanka.
Let's pause for this one, guys. That is really amazing. You guys did that very fast. As you know, guys, we didn't know that maybe one day there's a lot of positive cases, and you guys prepared very early, and look at that. That is really nice that you've handled the situation very smoothly, and you prepared the extension of the hospitals, and also prepared something that if in case that there will be explosion of the positive cases from your country, what the government did from your country is really intelligent, and I really love that. This is really amazing. Wow, I am now very amazed from your country, guys. This is so wonderful. So let us continue to the video.
Triage for fever patients was done at hospitals in all districts. Sri Lanka was one of the first few countries in the Asian region to detect COVID infection through PCR testing. The capacity was established within the country at the Medical Research Institution and greatly scaled up to provincial level subsequently. Free ambulance services were available throughout the country for anyone reporting COVID-19 related symptoms.
Wow. Wow. This is really nice, guys. Let's pause for this one, guys. That is a good thing, guys, that the ambulance is free of service. That is really good news to you guys. Actually, here in the Philippines, as far as I know, there's a charge. And yeah, as far as I know, there's a charge because the last time that I've talked to the ambulance, there's a service charge about it. And hearing this news, hearing this one, actually, I salute to your country, guys. That is really amazing. So let us continue to the video. Okay, they are sanitizing the ambulance.
Massive media support was vital to information flow, destigmatization, and myth-busting. With time worth millions of rupees for advertisements to control and prevent COVID-19 donated generously. Even songs were written, which were very popular and effective.
Wow. Wow. Wow.
COVID-19 prevention behavior.
Let's pause for that one, guys. What song is that, guys? What song is that related to the COVID that was sung for the COVID-19? Let me know, guys, of what song is that. So yeah, let's continue to the video. Here we go.
Became widespread, with workplaces and the general public being immensely supportive. Positive health behaviors were greatly advocated through mass media with tremendous impact. Physical distancing became the norm.
Wow.
With even major celebrations being confined to households.
Yes, physical distancing. Yes, to households.
Further aided adoption of good practices with an evidence base. Support and aid were obtained from the World Health Organization, UNICEF, the Government of Australia, the United States Department of Defense, the Embassy of the Republic of Korea in Sri Lanka, etc.
Wow.
The Ministry of Foreign Relations got on board with the other sectors at the initial stage in self-facing this multifaceted challenge. The Foreign Ministry took the direct responsibility to look after the welfare of the overseas Sri Lankans and establish links with the relevant foreign embassies. The ministry has been looking into the needs of the diplomatic and expatriate community residing in and visiting Sri Lanka.
Nice.
Schools island-wide were closed within a day of the first local COVID-19 patient being identified. This greatly reduced the risk of community transmission and possibly prevented the transmission to the elderly, as many Sri Lankan families have grandparents living together with parents and children in the same household.
Yes, I agree.
Work from home was encouraged across all sectors, with flexible working hours, rosters, and minimum staff.
Nice.
The government rapidly mandated work from home.
Nice.
Mobile.
Let's pause for this one, guys. Actually, the work from home, actually, that was mandated by the government, but I think it is also depending on the company that you're working, because here in my country, here in the Philippines, our client is from the US, so most probably they've announced, actually it is from our company, they've announced that we are working from home until the whole year, actually until next year. And actually here in the Philippines, as far as I know, they've already mandated the work from home, but it is depending of what type of work. So let me know, guys, about that, if you guys are working from home, or there are some still working and reporting to the office. Because here in the Philippines, especially if you are part of the manufacturing, yes, you are required to go to the office. So yeah, but hearing this kind of thing, we have the same thing that is mandated by our government, the working from home and the stop of schooling. Actually, here in the Philippines, the start of the class was started this August, and yes, and this was just started last week or last 2 weeks ago. And as much as possible, they don't want to open the school. They just have these online classes because health of the children is very important. Do you agree with me, guys? So yeah, let's proceed and continue to the video.
Door-to-door delivery of essential services such as food, medicine, and even banking commenced. Postal services were utilized for door-to-door delivery of prescription medicine from government hospitals. And
let's pause this one, guys. Is that true, guys, that here in the video I saw that the government, once they have something that to provide to each of the family from your country, they are just delivering door to door from your house? Is that right, guys? Actually, here in our country, Philippines, actually I'm not saying all the parts here in the Philippines, but here in, especially in my place, actually they did not deliver the services from the government. Actually, we need to go to the barangay. We called it barangay. We need to go to the specific place so we can get the support, the food support from the government. The one that I saw from here, from the video, this is really nice because this is to eliminate as well the contamination and also the spreading of the virus. This is a great job from your country, and I really do hope that our country, Philippines, saw this video from your country so that we can learn from it. This is very inspiring, guys. So let's continue to the video.
Orders from pharmacies, prescriptions, and clinic books were used as curfew passes for access to essential health services and medicines. Pensions were delivered to the elderly, or they were permitted to visit banks on designated days to obtain pensions. Supermarket and grocery chains immediately came on board with online and door-to-door services.
Let's pause for this one, guys. during the lockdown, does the bank still open from your country? Because here in the Philippines, once it was announced that there will be a lockdown, means all the banks are closed. So what I see to this video, I see to it that the bank are still open for the support that was given by your government. And actually this is really nice because it is a non-stop support from the government, and that is really lovely. So let's continue to the video. Nice.
Agricultural work
and
was allowed
economic
during
relief
lockdown,
measures.
and rice
Okay.
mill owners' work
Relief.
declared an essential service.
Okay.
Home gardening and cultivation
Wow.
projects were encouraged by the government to help alleviate future possible food shortages and insecurities. Daily wage earners and other vulnerable households
Wow.
were provided with social welfare payments to tide over the crisis. Many organizations and volunteers
really nice.
got together to give food relief and essential item packages
Okay.
to vulnerable families. Support of divisional secretaries was immensely valuable in the process. Education got on board very quickly, with online lessons
That
being
is really
conducted
nice.
by universities and a majority of schools.
Nice.
Provision of PPE
Community
and other
response
protective
and
measures,
innovation.
which were dire needs, was supported innovatively by the general public. The most powerful force of all the
Wow.
people of Sri Lanka was the biggest asset that changed the tide on this pandemic.
Wow.
There are vulnerable people with limited
Innovation,
reserves for
that is
survival,
really nice.
but they never fought
Let's
over.
pause for that one, guys. That is really amazing regarding the robot, the one who delivered food or medicine to the patient. That is really nice, guys. Wow, how did you do that? That is really amazing. Actually, that is very interesting on how did you do that. That is really fantastic. Wow, you are very brilliant minds, guys. That is really wonderful. So let's continue to the video.
Supply of essential commodities. There is no better testimony of the hospitality of the islanders
The
than
most
the
generous
thank you
country
notes
during
and videos
COVID-19.
of the tourists who were stranded in Sri Lanka due to the
Wow.
rapid closure of borders in their
Wow.
home countries.
Tourist.
They showed the world
planes,
that
okay.
humanity will prevail
No home.
even in the absence of financial incentives, and sets an example of rising above materialistic gain
Wow,
in a
without
time
going
of global
bankrupt.
crisis. So, we may say
Wow.
that our remarkable journey to success was founded on free health, free education, high literacy,
Wow.
a strong public health system, a
Free
supportive
health,
government,
free
and of course, our
education.
renowned hospitality.
Wow. Supportive government. Wow. Very inspiring. This is really nice, guys. So I'll be stopping this video since this is the video credits, and congratulations to all of our frontliners all over the world, from your country, from my country, and anywhere, because the frontliners did a great job, because we cannot fight this pandemic, we cannot fight this COVID-19 if without them. And that is really nice, guys. And this is a really inspiring video, a success story from Sri Lanka regarding on how you fight the COVID-19, on how you fight the impossible one. And that is really nice, guys. That is a really good one, and actually it inspires me a lot seeing this video, and that is why I saw that you guys are now allowing a mass gathering, because you guys did a great job on how you fight this COVID-19. And look at that, your government did a very fast plan on how you can fight against the COVID-19, and this is really amazing. And actually this is not just about the government, but also it is about the people, because if you don't know how to follow the basic rules, for sure you are one of the hard-headed, and if you are a hard-headed, so for sure the positive cases will blow up. And look at that, it seems that your country is very strict on making a guidelines, and I see to it that you did a great job, guys. This is very inspiring. This story should send out to all over the world, and I do hope that this video will go trending. And actually, this was released August 6, 2020, and it has 38,440 views. Come on, guys, we can support this video. We can send this to all over the world by sharing it to your social media, by sharing it to your friends, by sharing it to everyone you know all over the world, because this is the most important role that we can do by sending on what did your country regarding on how to fight the COVID-19. This is really wonderful, guys. Actually, I've watched how Malaysia did the impossible, and this is really amazing as well. And I see to it that you guys did a great job. And by the way, congratulations to all our frontliners out there. And also, I don't want to congratulate yet, but this is not yet over, right? The pandemic is not yet over. We're still monitoring about the number of positive cases, especially here in my country, because it's still going up. And I'm praying that and I'm hoping that soon this will end up soon. And yeah, that's it for our vlog for today, guys. I really do hope that you like my video reaction, and if you want to be part of our small family, don't forget to subscribe and hit that bell button so every time I do have a new video, we're going to notify you. So yeah, let us share this video. Let us share the success story from your country. Let us share on how you fight this COVID-19. So yeah, we're still fighting this COVID-19, right? Because we still don't have this vaccine yet. But what we really need to do is to take care of each other, and also sanitize your hands as always, and follow the guidelines, follow the rules from the government, and of course follow the social distancing, so that we can eliminate the spread of the virus. And also always wear your face mask and face shield. Especially here in the Philippines, we need to wear that face mask and face shield. So yeah, that's it. Praying for everyone's safety, and take care, everyone. See you again on my next vlog. Bye, everyone. Peace out.